How are you?
Oh, oh my goodness. A loving hug, years in the making, once two strangers, now friends with an unbreakable bond. And it all started with one swab. Good morning, I'm Alexis Delcid in for Jessica Lovell. Welcome to the Morning Medical Update. There is hope for the thousands of people diagnosed every year with life-threatening blood cancers. A cure does exist, but it all hinges on all of us to step up to make it happen. We're talking about Be the Match, the National Bone Marrow Donor Program. And Sue Flach is a true success story. She was diagnosed with a rare blood cancer. It was progressing. She needed a bone marrow transplant.
I'm young. I have 12 grandkids. I gotta be around for a lot longer. They pulled up 3 different people that were a good match, but Adam and I were the only 10-10.
Honestly, for me, it was a no-brainer. I'm a fireman. That's what we do, is help people. Just one more way to give back and help somebody else. And if it was me or my family, I'd want somebody to do it for us.
What a guy. So that was Sue and her stem cell donor, Adam Schroeder, after they met in person for the first time ever back in June. It was such a wonderful thing to see. And we are thrilled to welcome both Adam and Sue to today's program. Also next to Sue is her husband, Matthew, who's been really by her side every step of the way. Thank you all for being here. And Sue, I want to talk to you right out of the gate about your relationship with Adam, because you two, years ago, your family didn't even know he existed. But now it sounds like you're pretty well acquainted.
Yes, we are. We text message, quite often. And I always check and see how he is, because I always hear of a fire down there in Texas. And I'm like, are you in there? Are you okay? And he always responds. And we FaceTimed. And he also, when he was up here in June, we had such a magical visit. He fit in just like one of our kids.
Oh, I love that so much. And we're going to get to that visit in just a minute. Adam, before we even jump into this, you are in Texas, where you're a firefighter in Bryan, Texas, and you're on shift right now. So there's a good chance the alarm could go off at any moment and you'll have to go to an emergency. Yes, sir. You are just a hero no matter what you do. He's either saving lives as a firefighter or just as a civilian, donating his bone marrow. Sue's doctor is also here this morning, Dr. Sunil Abhayankar. Dr. Abyankar is a hematologist and medical oncologist at the University of Kansas Cancer Center. He's very busy because he's also the director of the Midwest Stem Cell Therapy Center. So busy that you're going to have to cut out just 5 minutes early at 8:25, yes, because you have patients to see, things to do. So thank you for squeezing in us during your busy day. We really appreciate it.
It's great to be here.
This must be so cool. I want to get back to Sue. When, Sue, you had your stem cell transplant, that was in February of 2022, so it's been about 16 months. How are you feeling?
I'm feeling great. Probably 90% normal, except the old brain kind of does some weird things. Like today, I thought it was at 9 o'clock, not 8 o'clock, but anyway.
Well, that could happen to any of us. Your cancer diagnosis, I understand you'd been living with a blood disorder for quite a while. Then the cancer diagnosis came later.
Yes.
So,
I think it was 2 August ago. I was feeling tired again, and so I had blood work done, or actually a bone marrow biopsy done, and it showed it had progressed to myelofibrosis.
So Dr. Abyankar, talking about Sue's case, how does something like myelofibrosis turn into leukemia, and what exactly is myelofibrosis?
So good question. So Sue, to begin with, had a very high platelet count, and she had a condition that's called thrombocytosis, which just means high platelet numbers. Platelets are the cells that are in the blood that are responsible for clotting, and normal platelet count is around 150,000. When you look at the CBC, you'll see 150, which is 150,000 is a platelet count. But when you have thrombocytosis, the platelet count can go very high, so it can go above 1 million. And then there's a risk for clotting, because the platelets are responsible for clotting normally, clotting of the blood. So that's the condition that she had. And we know that over time, the thrombocytosis that crowds the bone marrow then leads to a deposition of scar material into the bone marrow, and the scar material is called fibrosis.
Okay.
So over time, the bone marrow gets scarred, and when there is scarring that's occurring inside the bone marrow, then the normal bone marrow cells that are growing there, they have to move out, and then they go and crowd into the spleen and into the liver and make those organs enlarged.
So that's
by crowding.
how
And then
it
that's what happens in myelofibrosis, where the bone marrow doesn't have enough space for the
Okay.
healthy cells to grow. And there are certain mutations in the genes that are associated when these conditions happen. And some people who have myelofibrosis, if they have those gene mutations, these are, by the way, not inherited mutations. These are
This could happen to anyone.
These are acquired, acquired mutations. It can become into leukemia.
And you gave Sue a choice right out of the gate. You told Sue she didn't have to get a transplant. So why would someone choose to wait instead of getting the transplant, and what would be the alternative?
So myelofibrosis, is an incurable condition otherwise. And we don't have good medicines that can cure it. We have medicines that can control the symptoms. So when somebody has myelofibrosis, as I mentioned, the spleen becomes large and sometimes becomes really big, so that it causes discomfort. It can press on the stomach, and then the person has less appetite, they lose weight, they can have low blood counts and bleeding. So it is a condition that can progress over many years. In Sue's situation, we found when she had a bone marrow test done that there were some mutations in the genes in the bone marrow that would suggest that this myelofibrosis is evolving into becoming into a more aggressive myelofibrosis, which then is a first step into becoming into leukemia.
So Sue decided right out of the gate to go ahead and get the transplant. Sue, what motivated you the most? And I want to precede this by saying you have shared some amazing family photos with us. I'm guessing that kind of played into your decision.
Yes, we have 5 kids and we have 12 grandchildren. And I want to be around for a long time with them because they are my go-to, they are my life.
You talk sometimes like you have 6 kids now when you count Adam.
I do. Adam and
welcome to the
Kristen just
family.
fit in so perfect.
Matthew, as her husband, did you just go ahead and want her to do it, or did you have any apprehension?
I had the apprehension when they immediately talked about a transplant. She just immediately said, "Let's do it." I actually can remember plain as day, and I said, whoa, let's take a little time on this. And she made the decision, and on our way home from the doctor's office, we talked about it, and I said, I'll support whatever decision she wants to make. So it was a go from right out of the gate.
So then doctors send your blood information in to be the match, and then that's where we bring Adam in, because Adam, you had joined the bone marrow registry for a very specific person a while ago, but it wasn't Sue. So why were you on the registry?
There was a guy in our sister city who had leukemia and was looking for a match. So they came to our fire department and asked who would be willing to swap to see if we were a match for him. And after that, kind of forgot about it until they called and said, "Hey, you've been matched with someone. Would you still be willing to donate?" And it was obviously a no-brainer for me. And I talked to my wife, and she had the same apprehension, I think, at first, but we went ahead and, like I told her, if it was one of our family, we'd want somebody to do it, so we went ahead and did it.
So how long had passed by when you signed up for to be on the registry? Then when did you get the call? How much time had passed?
It was right at 9 years.
Oh, 9 years. Okay.
Yes, ma'am.
Wow. So that's quite a while. At this point, you might have even forgotten you'd joined the bone marrow registry.
Absolutely. Absolutely.
So your wife was on board. At this point, though, after you matched, you don't even know each other's names. In fact, they only tell you a gender. And so, Sue, you knew Adam was a 32-year-old man, and that's it. However, you have said that you found extra meaning in that number, 32.
Yeah, that was my lucky number.
Really?
Go back from grade school, then my volleyball number. Yeah. So
Oh,
32's
wow.
always meant a lot to me.
Where did you play volleyball?
St. Mary's, Kansas. St. Mary's
Nice.
High. Yeah.
Well, that's amazing. It sure is your lucky number. We want to take just a quick second to promote Be the Match because it is so necessary and incredible what happens on Be the Match. You can go to bethematch.org. If you are under the age of 40, you can join the registry. It's that simple, and you might save someone's life, just like Adam did, which is remarkable. Originally, you were scheduled to have bone marrow taken from your hip bone. But then the plan changed, and it was decided, Dr. Abyankar, that he only needed to donate blood, not the actual bone marrow. So what happened with that?
So when a person volunteers to donate their stem cells, there are two ways of donating the stem cells. The older method was where we actually go into the hip bone under anesthesia and aspirate out the bone marrow stem cells and then collect them in a bag. But over the past few years, more and more donations are being done from the blood, where we give a growth factor injection for 4 days. That makes the stem cells come out into the blood, and we can harvest them. So remember, in Sue's situation, we had detected these mutations in the bone marrow that told us that this myelofibrosis was becoming more aggressive. So when we have a situation where the cancer cells are more aggressive, like acute leukemia, then often we prefer the stem cells to be obtained from the donor's blood instead of the bone marrow. Because when we get the cells from the blood, we can get cells from all the bone marrow space in our body, whereas when we harvest from the bone marrow, we're only hitting the hip bone and harvesting the stem cell. So in myelofibrosis, there is scarring inside the bone marrow. So the new stem cells have trouble finding a place to grow. So if you have a greater number of stem cells, then that helps the donor cells actually take into the patient's body. And because we have these high-risk mutations, we want the donor cells to do their job quickly and get over those, kill off those bad cells that were in Sue's bone marrow. And one quicker way to do that is to go with the blood stem cells, because we get a larger number of cells and also we get more lymphocytes. And lymphocytes are the type of white blood cells in the blood that actually cause the fighting against the cancer cells.
So we've had quite a few viewers ask, is 40 a hard limit? It's a hard limit.
Yeah,
so
for being on the donor registry, it is a hard limit. But if you have a family, let's say the typing your siblings, and the sibling is 55, 60 years old, and they are a match with the patient, then that is acceptable in a family donation.
A family.
Yes.
So you're not going to pull strangers from Be the Match. So, say Adam join the registry at age 30. Is he just pulled off it at 40, or?
They may not be pulled off of it right away. It all depends on how many. So when you do a search for somebody who needing a donor, the DNA, specific DNA typing information is put in the database, and then the database will pull out, let's say 30 donors that are potential matches. Then we know that younger donors, like Adam, have healthier stem cells. So if a choice of 30 donors, then we can say that we only want those who are less than 30.
Okay.
And so there may be situations where somebody has some rare genetic makeup, so that when we look for donor on the donor registry, we only find somebody who's older and we don't find somebody who's younger. In that situation, we will go with the match that we have.
Just curious, does a stem cell donation mean that Sue and Adam are now sharing some DNA?
Oh yes, absolutely. Yeah, it is.
So if they took a 23andMe test, would they come up as related?
They will come up as a perfect match related.
A perfect match.
Yeah.
That's going to get confusing as this becomes more popular. If you match with someone on 23andMe, so you will match with your donor or recipient.
So, if the 23andMe is done on a blood test, then that's what will happen. But if the 23andMe is done with a swab from the mouth, which is how it usually is
Right,
done.
you spit into the tube.
Yeah, then actually they may not be complete matches. There may be some match there.
They'll show as
because
relatives.
They may come up as relatives. Yeah.
And so Adam will show up as relatives to all her kids too?
Possibly, yes. Possibly.
That is so cool. That is really interesting. I bet you guys love that. Sue, I bet you love that.
Yeah. So right now, Sue has Adam's blood in her body, right? So in a bone marrow, and so if the typing is done from the blood, then it'll come up showing it's Adam who's there. Yeah.
Oh my goodness. Well, Dr. Abyankar, we know your schedule is super busy.
Yes.
You need to get going right now to make your appointment.
Yes.
Okay, so we're going to let you take off to your next act of heroics. And I just want to ask you, before we let you leave, what's your final takeaway seeing Sue and Adam together and seeing the happy husband Matthew there and just being able to see this result of your work?
So a lot of things I can say. It is so great to see Sue doing so well, and she was determined. Like Matthew said, that yes, she wants to get this done quickly, and you made the right decision, Sue, because once we wait till the myelofibrosis gets advanced, then doing a transplant is more risky. There are more complications, more risk for rejection, and you are very lucky to find Adam as a perfect match. A young male donor is what we're looking for in the donor registry, and you had that, and you probably, I hate to say that, but you couldn't have done all that without Matthew supporting you through all this. I know Matthew and I kind of banter with each other when we meet in the clinic.
Oh, so you and Matthew connect?
Yeah, we kind of pull each other's leg a little bit.
Oh, I love that.
So yeah, but having Matthew help you through all this and be your main support and be with you all the time, I'm sure that contributed a lot too. So it's like all forces came together, to get this done and have a successful outcome.
Yes.
Sue, you're nodding your head yes. Anything you want to say to Dr. Abyankar?
I'll see you Monday.
Yes.
I do have a quick question from one viewer, if you can spare 30 seconds. Our viewer Yen Liang wants to know if CAR T therapy is better than a transplant. Would CAR T have worked on Sue?
So CAR T is not yet developed for myelofibrosis or even for acute myeloid leukemia. CAR T has been developed mainly for lymphoma and myeloma.
Okay. Thank you, Dr. Abyankar.
Right.
I
Thank
know
you.
You've got a motor.
Good to see you
really
all.
appreciate it. And the guys will unhook all the cords from you as you walk out so you don't take those to your next appointment.
Have a good day.
You too,
Bye-bye.
Dr. Abyankar. We love when you send us your questions and your comments, just like Yen Liang did. So be sure to send them to us on Facebook, YouTube, the Medical News Network email, Twitter. We're everywhere. And we love connecting with you. Quick question for Matthew. I want to bring the hubs in. So you've been front and row to Sue's recovery. What's been your perspective on what the transplant was like just in the immediate days after Sue received it?
Oh, we obviously we didn't know what to expect, but I'm going to put a plug in for the staff at the hospital. Anytime that something happened, they told us before they did anything. They said this was what was going to happen and what to watch out for, and they were just right spot on. I cannot say enough about the staff that at the medical facility. Her recovery was really good. We were fortunate. She's on a myelofibrosis Facebook group, and we see kind of some horror stories that a lot of the people are having, and Sue did not have them. She did what the doctor said. She exercised. It was just amazing.
I want to get to the good stuff because this beautiful video we have from just this past June, for the first time, Adam and Sue get to meet face to face. Clearly there were some strong emotions. Adam, what was going through your mind when you finally got to hug her?
I was just happy that we finally got to meet. We had talked on the phone and we had texted back and forth and stuff, and to finally get to meet her in person was awesome.
And now that you share DNA and you're part of the family, Sue, you look like you were just beaming the whole time, couldn't stop hugging him. What was going through your mind?
Yes. Oh, he's just such a remarkable young man, and for him to be so much like our family, I was really nervous before, and when just hearing his voice just calmed me, and I just knew he was a perfect match. I wished I would have known him before I had the transplant, because I had a lot of emotions of thinking, oh my gosh, somebody else's blood is going in me, and it was kind of freaking me out. And I think if I would have known Adam and the wonderful young man he is, it would have been easier to go through. But I've got to find out now, and we're just so blessed to have him and Kristen and the kids.
It looks like was that one of your grandkids hugging him and crying in the video? It just looked so sweet.
That was Swayze. That was Adam's daughter. Yeah.
Oh, it was your daughter. So she came along too. So you got to meet all the family got to meet. How beautiful.
The whole family. Yes.
That's wonderful.
Yes. I said they just all fit in. Even the kids were playing with all of our grandkids, like they were just part of the family.
Those kids are going to have a good Christmas this year. The family just got bigger and cooler and more interesting. And then, Adam, you got to hang out in Topeka for a few days after you arrived. And it looks like Sue and Matt showed you a really good time. What kinds of stuff did you do together?
Well, they had a little party at their house where I got to meet all their family, and our kids got to play with their grandkids and stuff. And then we went to the zoo, and we hung out with them at the zoo. Then Monday before we left, we got to go meet Dr. Abyankar and all the medical staff that took care of Sue during the whole process. So it was a really good time. It was a tiring week, but it was a good time for everybody, for sure.
The good kind of tired, where you go to sleep happy and wake up thinking it was a dream. Tell me about the T-shirts.
Well, I had those made. My daughter-in-law made those for us, because I think I saw the idea on myelofibrosis page, and they just mean so much, because I was not alone. I had all my friends and family, and I just felt so loved with it.
They're really beautiful. We love getting our community response to live throughout the program, so be sure to reach out. Oh, look at that picture. Huge family all wearing those.
That's all of our kids and grandkids then.
That's amazing. It's like a little army of beautiful, loving people. Be sure to send in your questions. We'll get to them in a minute. Now, be sure to send in the questions for Sue and for Adam and for Matthew. If you have any for Dr. Abyankar, we'll try to get those to him later on in the day and see if we can't get you those answers. Again, you could tweet us, email us, send us a Facebook message. We're everywhere. We want to bring in Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Switch gears just for a moment to talk about our COVID count.
Yeah, just briefly. Yeah, it's always good to work with Dr. Abyankar. I know he's busy seeing a lot of patients right now, has a lot of clinical duties because he does a lot of good work. So right now in the hospital, talking about COVID and our COVID count, we had higher numbers. Our numbers are getting back down as far as the active cases. We have 6 total. 4 active, 1 in the ICU, 0 on the ventilator. So good trend so far. We'll see what happens over the next couple weeks.
What's your perspective on this uptick we've been hearing about in the news, COVID cases across the U.S.? Some are calling it a surge, but your belief is the term might be a little dramatic?
Yeah, I think we need to just be careful. We know we've talked about, Dr. Stites has talked about increased surveillance in the water testing, the wastewater testing. That can be a harbinger of maybe increased viral circulation. We know that the CDC had put out something about their most recent data showing maybe a little bit of an increase overall nationally. I still think we are going to see more heterogeneous changes, meaning whatever community you're living in may be different than the next community over, or something that is further away from you. So I think we just need to wait about that as far as the overall numbers. And as we have talked before, this disease has really started to become a disease of those most at risk. So certainly age, those with immune compromising conditions, other chronic medical conditions like diabetes, lung disease, heart disease, all of those things put you at higher risk for hospitalization and severe disease. And so we really just need to see where it goes. And certainly we know the vaccine, the new monovalent booster vaccine, will be coming out. Hopefully that will be rolled out sometime in September. That will help protect. We know that we have Paxlovid. If you can take Paxlovid, get that, take that. That can help reduce your risk as well. So I think we really just need to see how it's going to go. And certainly 2 weeks from now, we'll have a little bit better data on the trend of where that is going. But we'll continue to watch. Certainly we were concerned this past week about maybe our numbers increasing. Now they were still under 10 active patients in the hospital, which is a good thing. And now it's back down. So I think it's just a matter of watching those numbers day to day and then going back and looking retrospectively, is there a true change in the trend? Again, hopefully we can keep the lowest numbers of active infections as possible.
Do we have any reporters on the line today with any questions for Dr. Hawkinson? We have plenty of questions coming in from our viewers for Sue and Matthew and for Adam. First one comes from Corey. Corey wants to know, how long did the actual donation take?
The actual donation was scheduled for about 6 hours, but ended up only taking about 2.5.
Nice. And then Sue, on your side, how long did it take?
Well, he had 3 bags of blood that I received, and I think I had to have each one within a 25-minute increment.
Okay.
So they did a bag, then they would go get another one. So it was pretty quick.
Adam, did you feel any side effects from the donation? Viewer Lynn wants to know.
No, ma'am. The shots made my bones a little bit sore when they were overproducing the stem cells and stuff. But as far as the donation went, it was literally an IV in each arm, and they pulled it out and got what they wanted. So,
what does it feel like when you say your bones are sore? Does it feel like a muscle ache?
It's hard to explain. I've never had anything like that. It wasn't just unbearable pain, but it was a little bit uncomfortable in your bones.
Okay.
They were aching. It would be the best way I could explain it.
Beyond that, was there, Sue, what's that?
I said, I'm sorry.
Oh, no, it's not a big deal.
Was there any sort of recovery, Sue, for you? Was there anything tough about it, or did you just instantly feel better?
Oh, no.
Yeah.
It was weeks before I started feeling better. And at the beginning, I don't think I got out of bed the first day and a half. And then I'm like, all right, I got to get up and get to walking again. And that's what made me feel better.
I want to bring you, all 3 of you, back for some final takeaways today. Sue, what's the most important thing that you want our viewers to know about your experience?
We need donors for the Be the Match. If Adam wouldn't have done it, I maybe had 2 other possibilities, which if you think about it in the whole wide world, that's not a lot of possibilities. So we need a lot more donors. And thank goodness it doesn't hurt them that much. And it's such a benefit to someone like me.
Matthew, you are sitting next to your wife with your arm around her, and she's alive today because of this guy in Texas, this firefighter that you didn't know 2 years ago. What do you want to say to Adam?
Well, like what I said when we met back in June, that I just love him. I love what he did, and he's part of our family now. One of them pictures that you showed earlier of the whole family, Adam and Kristen and the kids were all in that picture because they are a part of our family now.
That's beautiful. Adam, what would you like to say to the Flachs, but also to anyone watching who's on the fence about joining the registry?
I say if you're even thinking about it, do it. I mean, it was a no-brainer for me, obviously. Like I said, when I got the call that I had matched with someone, she was very similar, close to age with my parents, and you don't know who it is, but in the end, it doesn't matter. You're helping somebody that has a life-threatening disease, and all you have to do is go get some blood taken. It's nothing for me compared to what she had to go through. So, and Mr. and Ms. Flach know the way I feel about them. They want to come to Texas to visit the family, so we're welcome.
That's beautiful.
Yes, we can't wait to meet his family and thank them for having such a wonderful young man.
Families are built in all sorts of unique ways, and this is just another really unique way that your family has multiplied. It's just so sweet to see this and see all 3 of you together. Thank you so much for taking time to join us this morning. Adam, Sue, Matthew, we appreciate you. We're so happy for you. And thank you to our viewers for joining the conversation. Have a fantastic weekend. We will see you right back here on Monday morning.
Coming up Monday on the Morning Medical Update.
For Pam Wilson, the worst part of cancer was everything after the treatment. Graft versus host disease sent her back to the hospital again and again. I'm Alexis Del Cid on the next Morning Medical Update. Sometimes survivorship is the hardest part. How Pam faced her complications, both physical and psychological, Monday at 8 a.m.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.